Mr. James LeBlanc, Secretary of the Department of Public Safety and Corrections, and Mr. Thomas Bickham, Undersecretary, are here to answer any questions that you may have.
Okay, got 2 questions. You want to jump right in that? You want to do an opening, or what you want to do?
I do have a short presentation. I'll be very brief, if that's okay. I think everybody has a handout. I think we had it distributed.
Okay.
Okay.
We got, yes.
Okay.
You're going to go through this whole entire thing?
Yeah. Well, I'm gonna probably skip some of it for you.
Okay.
I know you guys have a heavy schedule.
All right.
Mr. Chairman, members, Jimmy LeBlanc, Secretary of Public Safety and Corrections, and with me today is Thomas Bickham, and some of our leadership team and wardens are here with us too. So I would basically skip to slide 3. I think these maps are kind of important for you guys to get a real glimpse of. I have 3 maps in here. One is the regional reentry map. These are each color represent a region and where we have reentry centers now that are actually, we partner with the sheriffs, and actually it's roughly $600,000 that we pay in addition to in these reentry centers. So we're getting to some numbers here. Before they go back to the community, they go through a reentry center for about 90 days of transition services, if you will, with programs, IDs, the things that they need before they return to the community. So I wanted to give you a glimpse of that. One of those is Louisiana Transitional Center for Women, which he mentioned in Madison, which is a good facility and doing some good things there with our female population. The next map is our probation and parole. You see a few colors there, that's regions, but you'll see it's hard to see. I know the blue is our district offices, 21 district offices throughout our state, and these are based on caseloads. That's how they are established, depending on the caseload in each one of those districts and regions. The next is the basic jail guideline regional map. Again, we have 104 jails that we monitor with our sheriffs, and each state facility has a monitoring team that actually goes out in their region to monitor the jails out of each state prison. I just wanted you to give you a glimpse of that. And you know, that's every 6 months monitoring visit that we pay to the jails throughout the state. So a couple of things on slide 6. I just mentioned a few things that I mentioned in the presentation. Dabity and Fort Wade are no longer state facilities. They have reverted. Dabity is back into the National Guard, and Fort Wade is reverted back to Caddo. So we don't maintain those 2 facilities. We do at Phelps Correctional Center. LCIW is you know, as she mentioned, that you know, we're in the middle of negotiating with FEMA. We still don't have a project work order, a PW. We hoping in the next several weeks we should have a more concrete answer from FEMA on what direction we're headed. I wrote a letter to identify this as a critical incident facility, which it is, and they will then hopefully approve us going to a 500-year plan, which means basically a rebuild of LCIW, and that's what we need to do at that facility. So, and then at slide 9, budget histories and memory. The one thing on slide 7 for us, the mandatory increases, I know every year we do this, and I just think it's so important for everybody to understand, especially for a large agency like we are. And so what I did was, you see the dotted line at the bottom is our mandatory increases. The first column, that 133 on the dotted line, is an accumulation of mandatory since 2009. So I picked it up there. So what I'm telling you is, and you see the breakdown, merits and market adjustments, group benefits, retirement, $52 million in increased retirement obligations that we have. Risk management, $13 million. Medical, don't forget, we closed the charity system, the LSU system. We have added roughly $37 million to our budget to pay for the non-primary care that happens to us in our local jails and in our state prisons, to include local prisoners. Again, over a period of time, it's $182 million. So that's money we've had to absorb in our budget to pay for. And again, I like to make that clear. The next page is a little bit more detail, basically saying the same thing. The current year's projected year in 105, we had $17.9 million in mandatory increases. So though it looks like we're getting the same amount of money, we have to absorb mandatories at almost $18 million. So if you go to the next slide, it gives you a breakdown of what those are, $17.9 million. Those are increases that we have no control of. The only one that we do and that's already been mentioned, is that one in yellow at $3.3 million at the bottom, which is a shift differential pay for our correctional officers. Basically meaning if you work on weekends or at nights, you get an extra 50 cents an hour to $1 an hour if you are a captain to a colonel. And that's the cost of that during the year. And what the next few slides give you a better idea of what that is. The next slide gives you a breakdown by unit what that cost us to do. If you add those two yellow columns up, that's roughly the $3.3 million. Each unit and how much it costs for each unit. The left side is a cadet through lieutenant. The right side is a captain through colonel. The next is just the kind of why, the security turnover. When you look at that, look at the numbers here. We're going to lose. We lost in that fiscal year through February, and we did 12 months, 1,329 correctional officers. We lost 1,329 correctional officers in 1 year. And as y'all remember, we got a pay raise. We saw some improvement with that pay raise, but we're beginning to see it's moving in the wrong direction. So the shift differential I think, is important in that we have people on FMLA, we have people on sick leave, and probably more than we should, just to be perfectly honest. And I think if you don't come to work, you don't get the shift differential. And I think that's important. So that's an encouragement for people to come to work. So I wanted to mention that. And look at Angola. Look, almost 600 correctional officers in 1 year. Unbelievable, the turnover. And the next is kind of the Family Medical Leave Act, gives you an idea of the numbers of people that are on family. It can be intermediate, or it could be on full-fledged, out on medical leave. And that number for the quarter is 337 people. And that's significant. Vacancies on slide 13, 309 vacancies. That's a little update from what Jamie talked about. So our vacancy rate, we just can't hire. We can hire, but we can't keep them. The turnover, we continually trying to get a complete staffing, but we just it's impossible. And basically all that revolves around turnovers. To add to the problem is job-related arrests. I know all of us have seen the write-ups in the paper, right? And they're the numbers. And these are employees. These are correctional officers that were arrested. One medical staff. I think the other part of this is correctional officers that were arrested over the last 4 quarters. That number totals 44. Again, the kind of applicant we get coming through the front gate is a struggle. And that's already been talked about on slide 15. A little bit about throwing of substances, Category B incidents, which is significant injury. Those are few and far between. We have one incident at LCIW, which was at Hunt, where we're housing female offenders in a male prison right now, but we did have an incident there. That was a one incident deal where nobody was seriously hurt, but there were 5 correctional officers that were involved in that. Other than that, it's been non-existent. Throwing of substance, I guess the upside of some of this is you see a little downswing in throwing of substance and other assaults. So I think some of the things that we're doing is beginning to work, but we have a long ways to go. And some of the contraband interceptions, things that we're doing on slide 16 is body scanners. Those are at about 150,000 each. We have body scanners now at every prison. Basically, you have to go through a body scanner to get into our prisons, and we're having to randomly do correctional officers because of the radiation issue, but we're getting to most of them. Shakedowns, I was involved last Saturday at Angola myself. We had a major shakedown at Angola. Didn't find a whole lot, which I think is good news, in that I was expecting more, but it wasn't. Drug screens, we continually 10% requirement of our population to go through drug screens, and of course training of our staff and doing a good job with that, and trying to get them through our training academy with the know-how to operate in a prison. The seizures of contraband on slide, I don't have a number on this slide, but it's probably 17. I think 16 was the last. Again, you see a little downswing on offender seizures on contraband, going from 1,400 to 991, and a little bit on the unknown on that side. Visitors is pretty much steady, and employees pretty much steady. But again, a challenge for our wardens and the things that they have to deal with day in and day out. Seizures on the next is contraband seizures on that next slide. You know, the drug side of that is, again, we see some good news here in the sense that it is going down. Things that I mentioned earlier with the body scanners and shakedowns are taking effect, and we're seeing a downswing in that, which I think is good news. Cell phones probably our biggest enemy in that regard. There's a lot of cell phone introduction, and we're trying to overcome that. But again, it's not an easy thing to do. So that's kind of the human resource part of this, and why I think the $3.3 million is a great investment for our state and what we need to do in our department to stabilize our workforce and to move in the right direction. Slide 19 is just a comparison. I think, I don't know if that was in Jamie's slides or not, but kind of where the average is and where we are. You know, that includes the 2439, so that really drives us back. I think our overall average is somewhere around a little bit below the southeastern average. I think it's $60 and change. So we're in the ballpark if you just take our state prisons and you average them out, which is on the next slide. And you know, that's on her slide, but I kind of wanted to hit on a couple of things here. And why is LCIW $102 a day? LCIW is right now in 4 or 5 different locations. We're at Plaquemines Parish. We're at Hunt Correctional Center. We at Jetson, which is an abandoned juvenile facility. We're at Angola with the death row part of LCIW. There's, I think, 5 females at Angola. The Louisiana Transitional Center for Women. And it's so 5 different locations. And of course, FEMA is, you know, we're billing for that extra cost, and we'll get some of that back. Dixon Correctional Institute, as you see on the left, dialysis is, what's the amount of the contract? $3 million for a dialysis contract. That obviously adds to their cost. It's a poorly designed. It wasn't designed as a prison. This is an old East Louisiana State Hospital addition. You know, the one that had closed, and back in the late 70s, it was opened up as a satellite facility. So it's more labor intensive in that sense. Hunt, obviously, high mental health, medical, aging population, and same at Angola. So that's why you see some differences there, and I just thought it'd be worth our while to look at that. Cost drivers, this comes directly from the slide. I highlighted that just on the average age. That average age is a 45% increase in prisoners since 2013 over 60. So if you project that out again over the next 3,500 by 2023, we will have over 60 in our prison population. And I don't have to tell you the costs associated with that, but that's part of doing this business, and part that we need to recognize as we ask for additional funding, especially in the medical area. The next slide is, and again, kind of emphasizes the need for the shift differential. I'm not sure about the bottom right. I have a big question mark about those numbers. I haven't had time to reconcile that. I think it's a little bit higher than it should be. But again, I'm still looking at that. Reinvestment of savings, and again, Jamie went through that pretty quickly. I kind of wanted, if you go to slide 25, community incentive grants, to kind of give you a breakdown. Remembering we're concentrating on 5 parishes that occupy almost 50% of our prison population, which is East Baton Rouge, Caddo, St. Tammany, Orleans, and Jefferson. So 48% of the people are coming from there, 48% of the people are going back to there. And if we're going to make this money work, we can't spread it out throughout the state. We have to concentrate it in those areas. And so that first step is these community grants that were awarded, and kind of gives you a breakdown of the amount in each parish. And on the right is the organizations that have been involved in getting those contracts in those parishes. So I want to give you a better view of the funding on the reinvestment side and where it's going. The next is victim services. That's the second part of the funding. Family Justice Center here in East Baton Rouge at $750,000. Crime Victims Reparation Fund, $300,000, which will be used to pay down crime victim claims that are still pending. Vines, the Lavins, the interface with clerk of courts, $300,000. and then CLEAR, which is going to help our probation and parole division to find victims, to make sure they're located and do the things that we have to do, making sure they're notified of any movement, parole hearings, discharges, the things that we have to do in order for victims to be properly notified. So the DOC investment, I think number one on that list on 27 is an important part that I always like to emphasize, because I think the local program is so important in our state. And I've said this and I'll continue to say it, that I think everything that we're doing is going to change the face of our criminal justice system. But for me, there's two drivers in our prison population. One is that we're housing so many offenders at the local level. And look, this is not a sheriff thing. I helped design housing at the local level, thinking this was an efficient way to do things. But what's happened is sheriffs can't afford to house them at 2439 anymore. So they can't do anything but to feed them and to keep them locked up. That's about all they can do. So if you get, East Baton Rouge is a good example. You get locked up in East Baton Rouge, you come out of court, you get on a van or a bus, and you go into Catahoula to spend a couple of years, and then you're going to be brought back and dropped off. And we have to change that. So how are we changing that? The investment on this, and our first step is Plaquemines Parish, and I say that because Plaquemines Parish had a 1,000-bed facility by the sheriff that was built after Katrina that was basically not being used. A brand new facility built with FEMA money. And so what we're doing, we're in the process, actually we're just about there of having it up and running. Anybody going back to Jefferson and Orleans will go to Plaquemines Parish 5 years out before they discharge, at least 5 years out, maybe less depending on, and you're going to get exposed to $1.9 million worth of programming at Plaquemines Parish. And in addition to that, on the community inside, where we already talked about, there's going to be in-reach programs where they can come in to the facility, visit with those that are discharging back to those communities, and understand what their challenges are before they return back to the community. It's a good partnership. It's one that's been a challenge to bring everybody together, to get them all working together, including our DAs, including our sheriffs. We all working together to make this happen. And I'm so excited about this opportunity, and that will move on. We already St. Tammany, then East Baton Rouge, and then Caddo. So those 5 parishes, I was hoping to have them up and running by the end of the fiscal year, but I'm not sure that's going to be the case, because this is a little bit more challenging than I thought. But again, I want everybody to understand this is a step in a direction that we have to have in good partnership with our sheriffs to get this accomplished. Day reporting centers are working. Now, number 2, are working in our probation and parole division. That's in lieu of being revocated. You have an opportunity to get on your feet before we revocate you. So there's exposure to programs and things that you may need in these day reporting centers, and it's working. And I think we have PNP here today that can talk about that if need be. We added two there. Thibodeau and Monroe are 2 additional day reporting centers. Specialty courts, I know we all talk about, especially our reentry court is so successful. So we are investing $600,000 in 6 different reentry courts to help the judges that are working so hard to make that work. And if you visit Angola, you'll see what I'm talking about on reentry court. Transitional housing, $370,000. That's a business this state hasn't been in, but it's a business that we need to it's a transition for housing, rather than going homeless, having a place for people to go to get on their feet before they return to the community. That's something that we're in the process of looking at, 4 or 5 different locations at this point. Hopefully, by the end of the fiscal year, we'll have that up and running. Some of the names of the places that we're looking at are on those bullets at the bottom of 4. DOC investments continued, probation and parole. We got reentry managers now in those 5 districts that represent those 5 parishes, where that agent is actually, that's what that agent does. It's a program manager, but they're working with the local community group, with the local parish prison that's responsible for those returning, and everybody's working together to transition back to the community. The right 7 is just the agencies that we're working with. The silos are down, and we're working together on IDs, working together with the Housing Corp for housing, obviously Workforce Commission on employment. Everybody's working together and making this a smooth transition. Some other things there, and number 9 in particular, increasing our industry-based certification programs in our state prison system. We're doing some one-time stuff there now to improve the availability of equipment that we need in order to train the guys and ladies that are in the prison before they return. The prison population, I mean, that slide has already been looked at. That 32,397 is below 32 at this point in time. At the end of March, it was below 32,000. So the numbers are still, I think, are headed in the right direction, and we're excited about less people coming back to prison, and that's important for us to understand. It's less people coming back to prison, and we'll see that here in just a minute. And that next slide is just kind of a general, the growth part of that slide, the stabilization and the decrease, kind of what transpired during those times. The next slide, 33, kind of gives you an idea of had we not done anything in 2012, where we would be. The savings has been, accumulated savings has been $202 million, and annual savings now it converts into $66 million savings with a decrease of 8,186 offenders. Probation and probe chart, 34, and you can see the numbers are. I mean, this is recently 72,000 and November 1st of 2017, we're down to 61,815, 11,000 drop in our probation and probe population. And what that means, you'll see on the next page, it means our caseloads are down to 121. It means that our agents are able to spend the time they need with the people they need to be spending time with. And our goal is to get that down to 100. And have a manageable caseload that they can work with, and for two different reasons. One is for the law enforcement side, but the other probably is more important is the case management side, that they can spend more time with those people that need more help in order to get on their feet. Recidivism, remembering this is 5-year recidivism on the right column, and it's down to 42.7 from over the last several years. And you convert that, if you take 42.7 and you take it from 46.2 at its peak, you can convert that into percentage. That's about an 88% reduction in people coming back to prison, and that converts into almost 1,200 people less coming back to prison when you multiply that times 15,000 that come back to us every year. So those numbers are looking good, and the actual number is less here. The next is 542 less people came back to prison in 18 than did in 17, and those are actual numbers. So that's a half a prison that didn't come back to us and are, that are on their feet and doing the right thing. Local housing, I know Micronauts and the Sheriff's Association are here. I guess the point of that slide that we have on 38, which was in Jamie's presentation, even with the investment part of this, even with our local reentry centers that are in sheriff housing, and you look at that 161 million, when it peaked at 193 million in 2000, we're still 32.2 million less in sheriff housing with all the investment that we're doing, and that number will continue to rise. I don't have any doubt about that we'll continue to see savings. We'll continue to see improvement in our criminal justice system and moving forward. And we're all excited about it. And lastly, Mr. Chairman, I have to recognize the people that work in this department. We have a good group of people. I know we read about the bad side of things, unfortunately, but we don't see a lot about the goods that are happening. But we have 5,000 employees that are working their butts off in our department to make our state a better place to live. And I always enjoy recognizing them, and I appreciate working with them. And that's the end. I might have taken too long, but I felt like I needed to say. But
That's all right. We'll jump into some questions. Representative Carter.
Thank you, Mr. Chairman. Thank you, Mr. Secretary, for the good work that you and your department has done. And I'm glad you took time out to recognize the good work that your department has done, the men and women in your department. And I want to pick right back up with, you were talking about criminal justice reform and the reinvestments of savings. And just to make sure I'm understanding, we get these documents and we get a lot of information fast, and make sure I understand it, that we have about $12.2 million in savings as a result of some of the criminal justice reforms we passed, approximately.
Go
Excuse me, Thomas Bickham, the Undersecretary. That was the first year's savings that we were allowed to carry forward as part of a VA7 for this fiscal year. The 8.4 of that is what we were allowed to invest, but we are continually saving money, and of course we're projected to save anywhere between 16.5 and 17.5 this year.
No, so that's good news. And I was
in
looking,
total.
And I think I was looking at page 24 of your slide, and you're right. The amount that's allocated to you guys is 18.5, and the total amount of savings for fiscal year 2018 was 12.2. And you expect that number to continue to increase over time?
I think that's what we're seeing. I mean, the first year was 12.2. Now we're projecting in excess of 17 million. I think a lot of the things that you see us doing will continue to have a return on investment. We're taking that money and investing in things that's going to make that number even better.
Such as reentry.
Correct.
And I saw that one of the maps that you all referred us to had the maps of all the different reentry centers throughout the state. Now, I've visited the reentry center that you have in Angola. My question is, how are the reentry centers that you have scattered across the state, how do they measure up to the program that I've seen?
So what you saw at Angola was reentry court.
Okay.
So that's different. The reentry centers, actually, we didn't add beds, but what we did was converted beds that existed in parish jails with the sheriffs in partnership, and we did a $600,000 contract saying these are the services you have to provide.
What kind of services are those?
Well, it could be IDs, it could be anger management, it could it's substance abuse, whatever the case might be. It's like 90 days. So,
okay.
But it's better than nothing. And
no,
you know
I agree. But it's not like at Angola they can become a welder, plumber, AC repairman.
No, it's not vocational training. It's not. Okay. It's not of that level. But what's happening in those 5 parishes that I talked about is that's 2 to 5 years of exposure to programming. So that is a big shift, and
okay.
It will be.
And I'm looking at page 31, and I can see just from 2017 and now, the prison population seems like it's continuing, or actually going back. It's steadily decreasing, and we expect that to continue as well.
We do. I guess I go to the per 100,000. We are number 2 in the country right now, and
which is still too high.
It's still too high, and the average for the country is somewhere in the 480 per 100,000, and we're still in the 700s. So I'm not saying we're going to get down to 400, but I'm saying that we're still too high based on the average incarceration of people in our country.
No, listen, I agree with that, but I think we need to make some steps with other agencies such as education, economic development to further stem the tide as well and to reduce our prison population. But from your perspective, I certainly appreciate what you're doing, and I want to see that continue.
Yeah, and I agree, and that's why OJJ is on the list this year to get some funding, and at least start with that part of it, to invest in our Office of Juvenile Justice for programming for them. And I think you'll hear Mr. Bush talk about that later today and when OJJ comes up.
One final question. We talked about it very briefly before this committee started. I received a question regarding a private prison in the state of Louisiana and whether or not that private prison has a 90% guaranteed occupancy rate that we're guaranteeing for a private company, and it's my understanding. Well, I don't. Let me ask that question and see if you can explain it to us.
And you're correct. Our contract is with the local sheriff in Wynn Parish, and the sheriff contracts with the private sector. But it is a 90% guarantee, and that. When CCA had that facility as a state facility, there was a 90%.
Well, it just seems mind-boggling. So make me help. So we're guaranteeing to a prison that they're going to have 90% occupancy, which means that we're going to go. How do we guarantee that?
Well, I mean,
I could come up with my own thoughts, but let me ask you the open-ended way. How do we guarantee? How do we make certain? Is it we're giving them money, or we're going out making arrests to satisfy?
It means that there's going to be a vacant bed somewhere else. Basically, is what that amounts to, because we have roughly 5,000 to 6,000 vacant beds at the local level already, and I think it's a few more than that. But I think you'll hear from Mike.
So it's just a matter of transferring from one facility to another facility.
That's what it is.
Okay. And what's the rate like at that private?
$24.39, same as the local.
So it's the same as the other rates.
Yes, sir.
Okay. All right. I'm sure there may be some follow-up questions, but thank you. Thank you, Mr. Chair.
Representative Omeny.
I know. 2403 is like that's the lowest.
Thank you, Mr. Chair. while I'm flipping pages here, let me just say that the chart on Jamie's page 13, the expenditure trend, that might be the closest one I've seen yet so far. That's interesting. But let's see. Secretary LeBlanc, in your handout, and thank you for the extra information, by the way,
Yes, ma'am.
pages 17 and 18 talk about contraband. We have contraband seizures by quarter and by type, and that's interesting to me. But what I was looking at was contraband seizures. You have offender, visitor, employee, and unknown. It's impressive to me that the offenders have this much contraband seized, but yet it seems the sources are so minuscule that there's hardly a line on the chart from visitor and employee, and I'm not sure what unknown incorporates there. But the contraband, are they making it? The items?
Contraband has a broad definition, unfortunately, and I didn't break it out here, and I probably should have. But contraband can be a gambling ticket. It can be too many bags of potato chips. So that gets a little bit overstated on that side of things. So that's why there's a big difference there. But with visitors and employees, that's going to be on the high end of probably drugs or cell phones.
Okay.
So that's the difference in those two. So that's a little bit overstated in the way that's being presented, and that's my fault.
Well, that's quite all right. I just wanted to have that clarified because, if, for example, if I was thinking that a lot of this contraband was maybe weapons, and yet I'm seeing that the outside sources are very tiny numbers, it would lead me to believe that maybe there was like one visitor or one employee who was providing thousands of knives, for example. So thanks for clarifying
Yes,
that
ma'am.
Contraband has a broad definition.
It
there.
does, and the next page is a little bit more defined in the the drugs and the cell phones and the things that we're finding.
Right, and it does help to look at the next page, but at the same time,
Yeah, I agree.
it causes me to wonder, how'd they get that many cell phones? I mean, they don't just produce them in jail, do they?
No, they don't.
They have to be coming from somewhere.
Yes, ma'am.
Yeah, I don't imagine they have access to Amazon and FedEx, right?
No, they don't.
Okay.
And I didn't mention this during the presentation, but as we cut off the supply, now we're dealing with drones. And drones, as you may or may not know, can carry up to 15 pounds of cargo. And so Angola's, seeing drones, and we're doing the best we can with that. But that's significant. And I've said this before in public. We're working with the FBI. We're working with the right people to combat. We're gonna get to the bottom of it, but we have a ways to go.
So you're saying that you've actually had contraband dropped off in the prison yard by drones already?
We don't have any proof of that because we didn't see it directly, but we believe that we have. Yes, ma'am.
That's a shame. Okay, thank you. I have a few more questions. Okay, back to the staff presentation. Let me see. Okay, on page 31, let me get there. That last chart talks about number of assaults. Actually, a few talk about assaults here. It appears that the assaults are increasing. You talked about making some progress, but on this chart, it appears assaults are increasing.
Yeah, and that's the one I flagged, and I'm not sure that I agree with those numbers at this point. I didn't have a chance to really to get into the weeds with that, and I apologize for that. I'll see if I can't get you an answer on that. I don't know that it's increased. I mentioned that before we came in here today, that I don't know that it's going from. Maybe it has, and I'm just, but I just think that's a little overstated.
Representative Omni, aren't you all the one that provide these numbers?
Yeah, but I'm not sure where they.
But, if you look, it says the source.
Yeah, no, it's where it's from us.
Source came from you all, correct?
Yes, it did, and I'm just not sure where we're picking up the numbers from our source, and that's what I need to look at. Yes, sir. That's
okay.
correct.
I just want to make sure everybody knew that.
No, that's coming from us.
That came from you all. Okay.
No, it's not Jamie's fault. Could be my fault. I don't know.
Okay.
So it could just be maybe there's a year delay. The numbers are from the previous year, perhaps.
Could
and
be.
you're
You got fiscal year, you got calendar year, you got when you compare years, it could run a little different. But I'm not sure if it's that much different.
Okay, so at least from your perspective, you're seeing improvement, and eventually it'll show up on our charts.
It will.
Okay.
Yes, we are seeing improvement. But again, we have a ways to go.
Okay, so something is working, and maybe next year we can get a report on what's really working and how much improvement
Yes,
there
ma'am.
is.
Staffing is, as I mentioned, is part of the problem, and we just don't, we're struggling.
You
And,
had mentioned that,
yeah,
right?
So that, hopefully if we can settle that down, that would help a lot of our challenges.
Okay. And in our notes, we have a comment, or actually a question about tracking of recidivism. And according to the question here, it says, why is the department no longer tracking the recidivism rates for offenders completing education programs and participating in faith-based programming? I'm especially interested in that. And then why isn't the department tracking recidivism of the reentry programs?
Oh, we are. I don't know, we are tracking the recidivism. I'm not sure why. It's not in the presentation. Is that why the question? You didn't have that? No, we do. I mean, we can provide that.
It's on our website.
Okay. So if we wanted to know specifically, are the faith-based programs working, we could find that information? Good. Good. And then prescription drug costs.
If you don't mind, I don't mean to interrupt.
Go ahead.
But faith-based is again, it's faith-based recidivism is probably not going to be as good as you would think it's going to be, because there's so many other things involved in that, and somebody, it's hard to track somebody that may be going to church, if you will, once a month, but they would be considered in the faith-based program. So there's some challenges with that recidivism number.
Perhaps defining it.
But I don't know do you have that? Do we have it? We don't have it with us, but we have that for you.
Okay. So my next question was, what would you recommend? What do you see that we could do to reduce the cost of the prescription drugs that are skyrocketing?
No, that's an excellent question. I wish I had the answer to that. I can tell you, we had we call him the bubble boy, but he was $1.5 million a year, and it's grown to $4.5 million a year to housing, and he's got another 10 years.
So this is one particular person with major health needs.
Yeah, and it's not uncommon to have 150, 170,000 a year for different offenders but what the answer is at this point, I don't have the answer. It's amazing to me though that we had $1.5 million and now it's 4.5, and they quit making a year and a half, and it makes you wonder what's going on out there. It's kind of like Hep C and the cost of Hep C. It's actually going down some, but they did away with interferon, which we were using, which was okay. They quit making it, and so that it drives the cost up for us, and we don't have a choice.
Okay, so let me separate the two angles here. When we look at your total budget for prescription cost, we see that it's increased dramatically. But when we look at the cost of a particular type of drug, like for Hep C, if the cost of prescription drugs that treat Hep C in your system have gone up dramatically, if they have, then is it because you have a higher number of your population that needs it, or is it because the drug itself is now more costly than it was before?
It's going to be a combination of both.
I was hoping you wouldn't say that.
Well, it is. I mean,
Okay.
it's unfortunate, but we have more to deal with and cost more. And as y'all, I'm sure Dr. Gee may have talked about it, but we're on a road of hopefully eradicating Hep C in our state, and we're part of that. And that's our goal in doing that, and we're excited about having that opportunity to work with LDH to accomplish that.
That's a really good goal to have, and I look forward to that. Let's see. Okay, going back to something from the very beginning of the presentation, we were talking about the LCIW being closed because of the floods. Okay, right now you have 600 and something of the prisoners who are housed elsewhere. In the places that they are housed, are you experiencing overcrowding? Are they okay?
We're okay. I guess okay is a good way to describe it. It's not an ideal situation when you have, double bunking. We got them a little bit, in dorms and stuff, a little bit crowded. But, the population has really been good about this. They've been very patient in working with us, and Warden Boutte, who's here with us, is doing a good job in managing that. at Hunt, at Judson, at Plaquemines Parish. It's kind of a batch of different approaches. We're building for program space at Hunt, for example. We're using COGEMS units from the National Guard so they can have some classroom space. So we've done some. We're in the process of doing that, and we've completed some of that. Judson actually, they have access to being a juvenile facility. They had some program space that we could renovate, but it's a maintenance nightmare at Judson to keep it up. I mean, everything is working, but to keep it working costs money, and that again is driving our cost up. But it, we're surviving, and I like to think that we're doing okay.
Okay, and you mentioned patience. The floods that were referred to were from 2016, and we're now in 2019. What's the plan? What's the goal? Is there a deadline you're aiming at? Where are we?
Well, the plan is, and Thomas, you might want to. Thomas has been working with FEMA. I'll let him maybe talk a little bit about that because he's been to most of the meetings. I attend one every now and then, but I can't get to them all.
I'm at the end of my patience right now, to be honest with you. I mean, this has been a very long process. We've been working with FEMA since pretty much after the disaster, and we are not even at the project worksheet stage yet. And of course, the project worksheet is where we apply and say this is what we think the damages are, and this is what we think should be rebuilt, and then they reply back with the actual project worksheet.
Okay, let me interrupt you for just a second there. Is there a looming deadline?
May 10th. So there was actually a deadline at the end of March. But as the Secretary alluded to earlier, we justified that LCIW should be classified as a critical action facility. During a storm, people evacuate to it, not from it. So based on that alone, it can be classified as a critical action facility, which now means you've got to build up to the 500-year flood versus the 100-year flood. So there's some extra requirements thrown in there and some additional expenditures associated with that. But FEMA seems to be having a hard time understanding how water can sit in a building for weeks on end, take more time for it to drain out, and then guess what? There's mold. And that seems to be the crux of the matter. They don't understand how mold from one part of a facility can go to the second floor of the same building, or when you have same air circulation, you have that same mold being circulated throughout the facility. So that's kind of what we're going back and forth with FEMA about right now.
Do you think maybe it would be a good idea to relocate FEMA headquarters to somewhere in South Louisiana so they can experience this stuff firsthand every day?
I'd like to relocate them to LCIW. I mean...
Okay. Thank you for the explanation. That's all the questions I have for y'all right now. Thank you.
Thank you.
Representative Abraham.
Thank you, Mr. Chairman. I just have a couple of questions. I was looking at the chart number 33 on the second handout, and it says annualized savings since 2012 is about $66 million a year. Evidently, I read that we had a number of different legislative bills passed in 2011 and 2012. And then, of course, we had the reinvestment program in 2017. So the $12 million that we're saving since 2017 is going into these different areas. What about the savings that we've had since 2012 to 17, which is very significant? Where did those savings go?
So, there was a program under the previous administration called GEMS. For some people, it was a dirty word, but for us, it was a good thing. This is what allowed us to start investing in these reentry centers, in these day reporting centers. So by taking that investment and investing it at the local level with these reentry centers, that's when you started to see the population decrease significantly. So that was a return on investment.
So you put that in those facilities.
Yeah, but not all of it. I mean, it's a small amount that returned that amount. So, I mean, you're looking at $600,000 per facility, 6 or 7 facilities, but look what it's saving us as a state right now. Now, also understand, Representative Abraham, that $66 million, that's if we'd have stayed at peak, 4,583 back in 2012. I mean, that is a huge difference between where we are now at 31,950. So, I mean, that's almost 10,000 less offenders.
No, and I agree. And the $12 million is a reduction from the peak of about 36,000. So
Correct.
Both of them are reductions from a certain
Yes.
peak in time.
Yep.
So you have the peak in time from 2012 generated a bunch of savings. The peak in time from 2017 generated the $12 million savings. So we're still I guess, technically generating another $40–50 million in savings.
Had we stayed at the previous levels, yes.
And basically, that would be going into other agencies. I mean, so where the money went, we don't really know, but it was a savings that was generated that you didn't have to budget us that funding.
So it never was designated where those savings would go. We just decided to designate from 2017
Yes,
forward.
That's right. That was done by
Correct.
legislation, yes, sir.
Okay. My last question, I had a House resolution, concurrent resolution, I think 73, back in 17, that said we're going to study the residential work release program, the sheriff's work release program, study it to see if residential facilities could do the work release program. I just want to know what the stance is on that. Has it been finished? Has the study been completed? It was a judicial referral agency that says you can refer it to residential facilities instead of the sheriff's work release program. Just an alternative to see if there was some
We submitted a report, but I'm not sure exactly, what was submitted.
Okay, I just like a report on that. I mean, we passed it in 17.
Yeah,
I don't know how long it usually takes to do
No,
that.
we should. I think we had a deadline.
I think we submitted it last year.
Okay. Maybe I didn't see it, or maybe you sent it, or maybe you didn't send it, but just like to see that report to see what the recommendation was.
We'll get it to you before the day's out.
Okay. All right. Thank you.
I
Appreciate
apologize
it.
for that.
Okay.
Representative Miller?
Good evening, Mr. Secretary. So, Representative Garrett spoke about the private prison contracts. I know most contracts have a deadline on them. When are these contracts up for renewal?
Our current contract is with the sheriff of Wynn Parish. It is a cooperative endeavor agreement, structured very similar to the cooperative endeavor agreement that we have with the sheriff of Madison Parish. It's got a 10-year timeline on it. But of course, a contract like that, because it's a state contract, can be terminated at any time for convenience once you give cause.
So is that the only contract we now have for private prison?
Yes. And we used to have two. I mean, it used to be Allen Correctional Center was a privately operated facility as well. They were both operated at state institutions, and then we converted them to local level. At the time, the provider for Allen decided that was too low of a per diem and they couldn't stay. So we took over Allen as a state-operated facility about a year and a half ago.
So the one we have in operation now is ran by local sheriff?
It is. Our contract is with the sheriff, but he contracts with a private provider to operate it, which is not uncommon.
Okay, next question. How long is this trial and error going to last with the 5 parishes that we're doing all of the Justice Reinvestment Act in?
Well, actually, I don't know if I'd refer to trial and error, and I'm hoping this is going to be. But we actually already start evaluating, quality-wise. It takes a little time. I mean, you got to start seeing some results. So, we're gonna keep moving it forward. Actually, next year's goes to Tier 2. It goes to the other it goes to the Lafayette's, the Monroes. We're hoping to expand it out to the next Tier 2 level parishes.
But that was my next question. That's why I said trial and error, because we have 5 parishes now.
Yeah,
and
we're gonna
earlier
increase
you mentioned it's better than nothing.
Yeah.
But how can I tell a prisoner in my parish that, sorry, if you was in St. Tammany Parish, you would have access to this, but you're here, so you don't?
Yeah, and so I think it's 8 parishes that we move into next year with the next year funding, 7 to 8 parishes, okay. Which again is the Rapides, the Ouachita's, the Calcasieux, those parishes that move us up to almost 70% of our prison population. Is the next
have we also thought about doing it on a person-to-person standpoint instead of an address? Because I see on here it has like they can get food stamps, you help them with housing if they might be homeless. So someone from St. Landry Parish may be able to be transferred to the St. Tammany area while he's doing the last 2 years of rehabilitation. Like, why are we doing per area code or per parish versus per person?
Well, I mean, that's where they're going back to, and that's the reason we did it. It's something to work with. It gave us there's no reason why you couldn't scatter throughout the state, but I can't get to everybody with the funding that I have. So you had to narrow the focus down to the numbers going back to those parishes.
But not everyone is capable of being rehabilitated, and I say that in a humbled way.
No, you're
But
right.
if your focus is on per area code, or per zip code, then why can't we do it like per person? Like I keep asking you, if a warden says, hey, these people qualify, they've done the right thing, they've been model citizens, why can't we transfer them to all of these resources in St. Tammany Parish and work them on getting back into society instead of it being based on area codes?
Well, it's not. It's based on parish, not area.
Well, you know what I mean, zip code.
Yeah, but I mean, it's pretty broad in area code. Well, I mean, you know.
Well, let's say zip codes.
Well, I mean, you could do that. I mean, I guess, you know, if a warden says that, but we're dealing with 104 jails, so it makes it a little bit more logistically difficult for us to do these things. And look, the guys that are doing good and doing, you know, we're concentrating on the ones that are not doing so good. That's the ones that need the most help. And so we you know, risk needs, it's moderate to high risk is what we send to these facilities.
But every legislator here voted on this, and the ones who supported it, I think we're doing a disservice for our citizens who are now incarcerated, who need this rehabilitation methods. But we're telling them because you're located in a rural St. Landry Parish, you're not eligible.
No,
So-
I wouldn't say you're not eligible. I mean, I guess, you know, we're trying to. I mean, we have the reentry centers. For that region, they would go through a reentry center if they didn't get to the centers that we opening up. I call them reentry centers. They're both reentry centers. One's more obviously longer than the other. So, I mean, I understand what you're saying, but we have to be patient with this, Representative, and we hope to get to everybody. I mean, that's our goal, and we're trying to do this where we can afford to do it. And you know, I mean, you have a good suggestion, and I don't mind, you know, putting it on the plate to talk about. But at this point, I'm just, you know, our staff are bogged down enough, and it's not that easy to get that kind of evaluation on a guy that's or a lady that's in a local jail to get that kind of evaluation and to ensure that they need to move into another level. But again, moderate to high risk. That's what we send to these facilities. The ones that there's some justification out there that too much programming can hurt them. It doesn't help them on the lower end, on the lower risk end. So I know that's not an answer you want to hear, but I mean those are the things that we have to look at when we're doing this kind of a major shift in the way we do business.
I'll just encourage you as we continue to expand, as we continue to save more money, we look more at the person, the individual, instead of that person's zip code.
You know, Lafayette, when we go to Lafayette, that's the next stop. I don't know why we can't. I mean, it could be a regional approach, and we can look at that because the numbers will go down. So we won't have the numbers that you have in Orleans and Jefferson where we just wouldn't have the beds to accommodate them. Whereas in a Lafayette, with kind of not as major as Orleans and Jefferson, we can include the surrounding parishes in that approach.
Well, I can guarantee you it'll be extremely hard for me to support any more legislation if it's not going to be a regional approach and everyone doesn't have access to this rehabilitation. I understand we're limited by money, but we should not have it strict to certain areas, but not everyone be able to receive this. So please, I ask you to develop a plan, because me specific, I promise I won't support any more legislation if my constituents don't have access to it. So thank you for your hard work.
Yes, sir. Thank you.
Representative Cheney.
Thank you, Mr. Chairman. Secretary LeBlanc, we all know how the escalating medical cost is such a major expense for DOC, but my question is pretty specific to this. What is the current DOC utilization for the prisoner medical care at the secure prisoner unit at Ochsner LSU Hospital in Monroe? Are we currently using that facility? And is Dr. Singh, is he still in charge? Okay, who is
Dr. Morrison, and Dr. Morrison is in New Orleans today at a meeting. Stacy's here.
That's such I think, a unique facility in their ability to handle prisoners without having to send extra staff and keeping those deputies, let's say, there in that unit with them, because there are already folks there that are working. So just trying to figure out if we're utilizing that facility to its fullest.
We are. I'm sorry. Stacy Falgout, Director of Nursing for the Department of Corrections headquarters. We do use that facility. We use the inpatient facility for our patients there, and then we also use outpatient clinic settings there also. HIV care, cardiac care.
Psychiatric.
We do not use psychiatric services there. The local levels may use that, but we don't as a DOC.
Would you say that your utilization is trending up or down, or do you know if it's basically staying even?
I don't know, but I could get that information for you.
I believe that possibly it is being underutilized. And is there any other facilities in the state, Mr. Bickham may know this, that are staffed and secure like that, other places that y'all can use?
We do have a similar type setup down in New Orleans at the hospital there. I'm not aware of any other besides those two.
If they would do telemedicine with us, that would definitely help us utilize EA Conway more.
They're not using any telemedicine with you at all?
No, sir.
Because I know they're set up to do that. They do that in certain programs there. What have y'all had this conversation with them?
Yes.
We have. We have had. And telemedicine in North Louisiana is a challenge. And the reason I think is that we can do the telemedicine deal, but we still have to go. I mean, we have to go in for the appointment, and a lot of times they won't even accept the information from the telemedicine contact.
They have a closed system, so it has to be a physician that has privileges at EA Conway that holds the clinic, or so. They would have access to the diagnostic tests and things like that. That's why we've not been able to do this in the past.
So let me understand this. If a patient, let's say, is a potential surgical patient, and you do a telemedicine conference, I guess back and forth with symptoms that this prisoner has or whatever. So at that point in time, what occurs? They say, okay, well, bring them on, or kind of run through that for me.
So HIV care would be a great utilization of telemedicine at EA Conway. Pre-op appointments, looking at lab work, medical clearance, EKG clearance before you do a surgical procedure.
Okay, well, once that pre-op work is done, you're saying that when the prisoner arrives there, they don't look at that information or that part of the chart and use it, and they duplicate the efforts on that particular patient before they see that patient for treatment?
If it was not completed by a physician at EA Conway with hospital privileges, yes, sir.
What about the one, Mr. Bickham, in New Orleans? Are they operating the same way or differently?
They operate the same. They hold the telemedicine clinic, so they're already seeing our patients. But they also allow our primary care doctors to order testing at their facility, so that opens up access. Whereas EA Conway and in Shreveport, we don't have that.
Interesting.
It is.
Okay,
it's been for a while. North Louisiana is just no telemedicine. South Louisiana, working with LSU, in New Orleans is a lot easier. Even though we are going through a few little hiccups with them at this point on the funding side.
Sounds to me like certainly we need to get into a room, lock the door, and figure out, what the heck we're going to do.
That saves us a lot of money when we don't have to transport, believe me.
Okay. Thank you, Mr. Chairman. Appreciate it.
Representative McFarland.
I'll be brief, Mr. Chairman. Thank you. Secretary, on page 20 of your handout, and then on pages 7 and 8 in our handout,
okay,
it lists the number of inmates currently occupying each correction center. And as I look at the cost per day, per inmate, of all your correction centers throughout the state, you have an average listed of $60.09. The least expensive is Wing Correction, correctly?
Yes, sir, it is. It's at $24.39. Well, it says $75.
Yeah, because we've got some maintenance issues that we
yeah.
roll into risk management as well.
Okay, so, but it's less than half of your average.
It is.
Okay, so it's the least expensive correctional center you have occupying inmates.
It is, but remember that they don't have they don't have what we have in the state prisons. Even though I mean it's the per diem at the local level, but what they have profile wise is the offenders that are housed at the local level. So mental health issues, medical issues, the infirmary there is unoccupied. I mean, so it's not the expenses are basically the same as the local level. So, but yeah, I mean when you look at it from a standpoint of that, it is.
And historically, before we converted to the local per diem, it was the lowest per diem at state-operated facilities. It was in the $31, $32 range for both Wynn and Allen.
Right. And so even before it became a jail,
It was the low.
it was still the lowest.
Yes, sir.
Okay, thank you.
Representative Edmonds?
Thank you, Mr. Chairman. Mr. Secretary, I was wondering, how do we rate, so you're talking about staffing, just sort of give us a little help. So how do we rate in the southeast average of what we pay a guard that you're having such high turnover?
I think if I remember right on the study that we did, I think
Mississippi was slightly lower than us, but I think since that study, they did a raise and we did a raise, and I don't think we kept up with theirs. So I think we are probably the lowest rung in the state in the southern states.
And in relationship to the locals, would that be a deputy sheriff that works in the locals? And how do we compare with that pay in that system?
Mike can probably answer that better than I can, but I would say that they have probably two different scenarios there. One would be a deputy and one would be a jailer. Probably two different salaries, but I would suspect that their salaries are probably better than.
Is the staffing as big of an issue for those guys as it is for you guys?
I would assume that it's not, but I'm not sure, to be honest with you, Representative.
But it is your highest level of turnover is
Correctional officers.
correction
No
officer.
question.
I mean, that's
Yeah.
what drives it.
And I know that, I didn't mention this, but I mean, in some areas, I think Angola, if you look at cadet to sergeant, it's 52% female in a male prison. And I don't mean that in a bad way, because we can't do without our female correctional officers. But, it's a challenge, and that's part of it, too, in that regard.
Well, I would like to know the difference of, it would seem as if you'd have the same type of staffing issues of why one would not want to work for the Department of Corrections, but they don't mind working for whichever parish, let's say Wynn Parish or Sabine, it doesn't really matter, that sheriff's office, if they're not having.
That's a good point, Representative. I guess one thing that comes to mind for me is the environment in our state prisons is a little bit different in that, we're dealing with mental health. We have cell blocks. We have the segregation issues, the medical issues.
So you think maybe the struggle of that,
I think some
that
of it
tension
has to
that's
do-
caused for that?
I think that's part of it. I don't
Yeah.
think that's all of it. I think pay is the probably bigger part. But again, I agree with you. If and Mike might be able to speak to that when he comes up. But I don't think they have the same problems that we have in regards to turnover.
Well, I don't mind waiting, but I would like to hear that when
Yes,
those
sir,
guys
and,
come to the table, because obviously
doesn't have
that's
that
a
answer, we'll give
pretty
it to you.
important question.
Sure, no,
of,
that's a great answer.
I'm not
Great
suggesting you guys are doing anything wrong at all. Just trying to. I'd just like to. Of course, we'd like to help you to make sure you get. This doesn't need to be a problem you have to deal with year after year after year, and obviously, this is your biggest headache.
Yeah, I mean, overtime for us is what? How much?
Projecting about over $15 million this year.
$15 million
That
in
is
overtime.
significant.
When we have a vacancy, people think some people think we have vacancies because we're saving money. We have to fill it with time and a half.
Yeah.
At the correctional officer, so that those vacancies aren't doing us any good.
They cost us money.
All right.
Overtime.
So I'll wait till those guys get up, and we'll ask that again. Or I don't really need to come back to Mike. If you guys will answer it when you get up, that'll be fine. I have a couple more things in a different area. So in the 2018 reinvestment or savings, and you broke it down in three categories: 30%, 20%, and then 50%. So the department's getting the largest portion of that, $4.271 million that you put back into reentry services. But then again, there's no training involved with that. That's helping them with basic things they might need to just actually hit the street. Is that kind of the...
Oh, that part of it is no, that's training in that.
Training
no,
is,
yes, sir. That's
is involved in
vocational
that.
training. We partnering with Delgado. We're doing things in that area that we're moving in, vocational programming, GEDs, the whole works.
Yeah.
The whole educational works is involved.
I'm assuming that if we were to be successful to continue to move in this direction, you'd continue to want to up that ante, because we've seen pretty good.
Yes, sir. We've seen
pretty good
results
success
from
in this,
it.
right?
Yes, sir. We are, and I know that we're going to continue to see that success. Obviously, down the road, it's going to stabilize, but we need to get to where we need to be, and we're not anywhere close to that at this point.
Right. Well, I commend you on that. I think that's obviously the reentry part of this is the thing that we've got to get right.
Yes, sir.
Because we want
Thank
to
you
keep
very
them.
much.
We want to keep these folks with their families and keep them out of jail.
And that's a good point. And that's moving them closer to home is getting them in contact with their families.
Yeah.
And
We're all the better if this works.
Yes, sir.
Yeah. One final thing, and that was in the sort of a similar area, was in the grant part of this that you guys are working with. And you listed a variety of community incentive grants, and you sort of give us some categories, and I don't really care about which one. I'm assuming that they're sort of a list of priorities as they make application to provide the grant, and then they're able to provide the type of thing that is guidelines you give them. Is
Yes,
that
sir.
sort of how it
we
works?
actually went out on an RFP. We bid it out, and that's what that yes, sir. That's kind of how it works out. Some are providing wraparound services, the complete component of returning, and here's Nally, she can explain it better than I can.
Yeah, so if it was the United Way, for example, then
Right, that
United
would be
Way
more
would
wraparound
they would
service,
they would provide
housing,
that
employment,
service.
yes, sir.
Yeah,
and then for Louisiana Parole Project is a little bit different. They're helping guys that have been down a long time and helping them with their parole. So it's different approaches. The female part of this is kind of in reach, if you will, with the female population. So
then how do we review then not the inmate, but how we end up reviewing how, say, I just use United Way, I'm not picking on them, but how then do we use and say, how did United Way do with the grant we gave them?
Yes, sir. Natalie, Board Department of Corrections. So we have two mechanisms in place for the review. On one side, in the reentry division, we'll have a contract monitor, 2 contract monitor positions that will be monthly reviewing these on site, and then also the grantees are required to submit monthly reports. And then also within my section, we have a quality assurance mechanism. So after annually evaluating not only the contract data, but looking at this holistically, is this in line with, are the services and the results in line with criminal justice reform as a whole? And also the monetary side will be reviewed by our business office.
So we're fairly satisfied with they've met their objectives?
Yes, sir. And we're just, those contracts have just started over the last couple of months. So they've submitted those that went into effect in January and February have submitted 3 monthly reports thus far. And everything is going according to task at this
And
point.
are you attempting to stay within this 2.5 million that was allotted of what we're looking at on this what was this 18s? Is that what this was?
Yes, sir. So that 2.5 million set the dollar limit for how much would be awarded in terms of those community service grants. And then now we're currently planning the process of the RFP or grant applications for the second round, which will come from the second year of the savings generated.
Well, I just want to say I appreciate all of these, and I have viewed, and I think I've been to multiple things with your parole, and by the way, those guys are phenomenal. I mean, they do a great job. I visit that multiple times. I know they've been over case loaded and underpaid, and we tried to get them a raise. I think we got them something, but they've been nothing more than spectacular in dealing with them, and the care level they've given for trying to help people get back. It's been pretty. I've been pretty impressed with those guys.
Absolutely, Representative. That it's been a shift for them culturally in a lot of different ways, and they have really stepped up to the plate and doing some good things out there for us. And I think I'm excited to see them come on board and working with us. And Pete Freeman, our director, is doing a great job of heading everybody in the right direction.
I really don't think our folks have the idea of just how involved they've become to trying to help a person get their feet back under them.
Yes, sir.
But I want to commend them for what they've done and what they are doing, and I see them as a kind of agency that's basically giving the shirt off their back if they have to try to help. That's the way. That's what
They're
I've
a key
seen.
component of this,
Yeah.
no question.
Well, thank you. And any information and more that you can give us, I think the more the public recognizes this reentry part of this, I think is the greatest portion of not just the investment, but of us trying to get the public with us as it relates to corrections in Louisiana.
Yes, sir.
So the more you can give us on that we can get to our people, I think the better we can do.
Yes, sir.
So
I appreciate that.
Thank you, Mr. Chairman.
Representative Smith.
Thank you, Mr. Chairman. Mr. Secretary, I just have a question, well, a couple of questions, but is there a correlation between the number of cell phones that are brought into prisons based on the amount of money that's charged for the phones?
Somehow I knew you would ask that. But unfortunately, there is some truth to that.
Yes.
But we also are finding out, and I don't know how far I can go without saying all this, that they're using these green card communications with these numbers on these cell phones, moving money around to deal in drugs.
Okay.
So there's a lot of that going on, and so that's what's got me on a chase to stop it. But there are other reasons for it too, and that is, there's no question there's some truth to the cost of calling home with our population. We're trying to work on that, Representative, as best we can. But what we find lately with these cell phones is that they got these green cords, and it's just it's a network, and it's like Swiss bank. You can't trace it, and so I probably shouldn't be saying this, but anyway, we're working on it.
Okay. The other, when Representative Amity asked about the recidivism and the 5-year rate going backwards, because there were no dollars related specifically to reentry, there really isn't any data at that point in time that you can go back to and say this is the reentry data related to, or recidivism rate related to reentry. It's not until 2017 that we started really putting in that data. Is that correct?
That's exactly right.
Yeah.
And we had a little reduction there with the 2012 with
Right.
the GEMS project that's working. So we're seeing some improvement, but I think you're right. I think when we start seeing the results of this reinvestment, it's going to be even move a lot further along for us.
Okay.
Yes, ma'am.
The other is, tell me a little bit about the line item on page 17 of the report, the actual report. It says discharge pay for released offenders. What is that discharge pay?
Is that on the first report?
On the one that Jamie did.
This is for offenders that are released from state prisons. They receive a bus ticket and discharge. I think it's either 10 or 20. I think it's $20.
Okay. There was a question asked at a community forum I was at about I guess it's a reinvestment program that's being allocated $500. Are you aware of that for any reinvestment program that folks are having $500 given to them per inmate for any programs?
No, ma'am. I haven't heard that.
I hadn't heard it either, and it was, somebody must have heard something.
That's in the
Okay.
probation and parole to help them get on their
They
feet.
need clothes. If they need a
Okay,
place
so
to
there
stay,
is
we can pay the
there is
Salvation
something
Army.
going on with that.
And that's
Okay.
out of the inmate welfare fund. That's
Okay.
not out of the we're doing some reinvestment initiatives with that as we speak to help improve that. But that's a big deal for our agency
Of
to be able
course,
to have
yeah.
some funding to help these guys, even to the point of maybe getting them a bicycle to
Right.
get to work.
I was
you know?
excited when I heard it, but I couldn't give any information on it because I wasn't aware.
We're doing a lot
of
of
that.
That's a P&P initiative that they're doing a good job with that and helping these guys when they get out
Right.
there, and ladies.
Thank you. And I know that, and I really have to say I appreciate you giving us all the space and whatever for the Women's Incarcerated Task Force. And there's some interesting things going on right now with the task force. And I would you tell me about that, Natalie?
Ma'am.
Yeah.
Well, the task force was created last session pursuant to a resolution that you authored, and it really tasked us with focusing on the criminal justice spectrum, specifically as it relates to females. And I think we have a great membership that's appointed by the governor, and it's made up of members of the community with some sort of relationship to the criminal justice system, judges, formerly incarcerated females. Secretary has been so supportive of it. He designated me as his proxy, so that the chair of the task force. I spoke with you a little bit about this a couple weeks ago, but I think it's a great time to officially tell you that we will be receiving technical assistance from the Crime and Justice Institute, who is partnered with DOC for the implementation of criminal justice reform as a whole, which is really going to be, I believe, something that can help us better dig deeper into some of the policy areas that we can make recommendations for changes. Secretary and our Chief of Operations, Chief Smith, have been extremely supportive based on some of the other ongoing changes that we're making in the department related to segregation and some of the things that our chief observed while traveling abroad. So we've really been tasked with looking at some really forward-thinking things.
Yeah, very good. And I'm really excited about what's happening in there as well, because, you know, that was our lost population for some time, and now at least we're giving some credence to the fact that we can do a much better job of females who are incarcerated. And my question is, I know they're trying to work out the issue of the females who are enrolled in the welding program. We're at Hunts now, seeing whether or not that's going to be able to get to any point where they can continue that training, and I'm hoping that's going to come online at some point in time. Because we lost everything related to the welding program that they were going through. So maybe Warden Boutte might want to talk about that at some point in time, or even through the task force, letting us know, because it was mentioned in the task force that they were going to try to work something out to do that. Okay. I think medical parole. How are we doing on medical parole right now as far as individuals who are able to get a medical release? Stacy's coming. Okay.
To the actual how the laws govern and how it's set up, and then if you want specific stats, are you talking about the medical parole or the medical treatment furlough program?
Well, the medical parole, an individual who is deemed to be eligible for parole through administrative.
For the medical purposes.
Right, for medical purposes.
Yeah.
Are you asking about Stacy Falgood?
Yes, Stacy. Mm-hmm.
Are you asking about medical parole, medical treatment furlough, or all?
Well, both medical treatment furlough, but mostly, have we increased any on being able to get those who are medically fragile, giving them the medical parole opportunity?
We have.
I know that's done by administrative opportunities.
We do.
Yeah.
Our numbers have increased. We've worked with the units, looking at all their patients in the infirmary setting and their assisted living dorms for all DOC facilities. But those numbers have increased. I don't know the exact number, but I could get those for you.
Okay.
We have them, Representative.
Yeah.
It's just a matter of getting it to you.
Okay.
That's the one thing I don't have. I have Hep C, I have HIV, I have all that, but I don't have the parole numbers. But we'll keep up with it.
Okay.
We can kind of show you over time.
Right. That's what I'd like to see over time, what we've done in getting some of those individuals outside of the prison walls for medical reasons.
It is going. I think it's going as good as you could expect. Mm-hmm. You know, I mean, it's certainly better than what we had.
Okay. All right. Well, I think that's all that I had. Well, thank you very much.
Yes, ma'am. Thank you.
Board is clear. Thank you.